Hello. Today my project is going to be based on can Suboxone be a viable outpatient option for heroin addiction? The article that I researched was by Chairman Siddhabalam, who is a doctor. The article was written in 2014. I am Karina Valles, and I am presenting this for Riverside City College. My question is Suboxone an answer for success for heroin addiction and recovery as outpatients versus the traditional method of methadone? Methadone usually involves methadone clinics. Well, let me back up here. So it's methadone versus Suboxone. Methadone usually involves methadone clinics, a full opioid agonist, which agonist causes the same action as the substance that normally binds the receptor. So pretty much it's like heroin with heroin in a sense. There are frequent dispensing schedules made by the clinics. Methadone is federally mandated option, and it's usually the traditional option for anyone who's suffering from heroin addiction. Suboxone, on the other hand, can actually be used as outpatient versus inpatient, and it's a partial agonist. So it's not as strong as a full agonist, which is also methadone. There's less regulations when it comes to the dosing schedules, and it's an office-based treatment, meaning the patient can actually get the treatment while trying to live a normal life versus being inpatient. The participants that were used for this, there was 220 participants, mostly male. Most of them are unemployed, and obviously they do have to be heroin addicts. The age range was anywhere from 18 to 67 years old. So the procedure here where participants were followed as outpatients for maintenance treatments and counseling. They were seen on a weekly basis for the first month, and bi-weekly during the second month, and every month thereafter. Counseling was mandatory, and it was provided on a weekly basis for the first month, and then every 2 weeks in the second month. On those counseling sessions, each encounter that the participants had, a health survey was given to them on every visit. The health survey was regarding demographics, epidemiological and clinical parameters, as well as criminal charges or any kind of criminal history, and quality of life measurement, like how happy are they, where they're at in their life, and then during their treatment. Here is a graph where it shows that the hypothesis is supported. It shows the physical function, the role of their physical bodily pain, general health, the vitality, social function, role of their emotional health, mental health, overall physical health, and overall mental health. What the graph shows is the overall trend of each of the 8 individual health parameters and the patient perception of overall mental and physical health. You can see here in the graph, it is seen that over a 12-month period showed a progressive improvement proportional to the length of the treatment of Suboxone, since this was a 12-month study. When comparing the scores at the baseline of 0 months up to the 12 months into treatment, overall increase in patient perceived mental, physical, and emotional health can be seen. So at the end of the study, it shows the hypothesis is supported. Suboxone is a viable outpatient option for heroin addiction. It was proven that emergency department visits and hospitalizations associated with drug abuse declined in the year after starting the treatment with Suboxone. Number of charges for illicit drug possession decreased from 70 charges in the prior year to 62 in the year after starting the treatment. Other types of charges also decreased in number were prostitution, fraud, violation of probation, and trespassing. Overall increase in patient perceived mental, physical, and emotional health also was shown in the 12-month period. So in conclusion, it is showing that Suboxone has been marketed as an outpatient treatment option for the prescription opioid abuse. It is found that using the drug that using this drug for heroin abuse does have potential as an alternative to the hard to manage and federally mandated option of methadone. So it does show that Suboxone actually has helped a lot of heroin um, addicted people, and it is a much easier option for them. It does show their overall health, mental, and law when it comes to their law, and actually the use of our hospitalization and emergency departments, that it actually within a 12-month period it does show to be successful compared to the methadone treatments and methadone clinics.